The subscap sits on the top of that. And what happens is a lot of people, it's very similar to the infraspinatus where there's not a lot of tissue in there. So you want to get it just right. And I like to do this with the client laying on their back. So you always want to use some lotion. Lotion is going to really help because it's a very sensitive area. What you would want to do is get your table up as high as possible as you can, because that's going to help you with your body mechanics. Now the key is actually the positioning. So what you're going to do is have the client scoot their body over a little bit, and that's going to get everything to open up. Get a little bit of lotion in there to open that up. Make sure you watch the advanced palpation of the subscap. If you don't watch that and get this right, and you try the treatment before, it's going to be very counterproductive. Now the key is going to be in the motion. So once we get in there and we find the area that needs the treatment, what we do is we start it in a very shortened position, and then the first thing we're going to do is get this arm to open up and come back. That's our first motion. That's the motions we always want to get on the shoulder, is bringing this arm back, because if we don't get that, it doesn't matter what the other motions are. So the key here is your body position. So we want to approach it like a 45-degree angle, very similar to what we talked about with the infraspinatus. So the motion here is I'm going to be lined up just like that. And as we go in, that allows me to sink in on that subscap. Then I back out. I've already done the palpation. I've already found all that. And then I'm going to put that muscle in that shortened position. And my depth is going to be just a very slight drop in with my body weight, maybe about 4 or 5 ounces of pressure. And then my tension is going to be a lean straight across. And that's loaded up. And we're going to put in a little more shortened position. And what you're going to do is slowly start to drop that in just like that. And you're going to go very slow, very precise. When you feel it start to pull, now you're going to shift your body around and you want a traction with that. And you're not in a rush. You're getting that to open up. You're leaning in with more of that tension.
Body mechanics.
You want to continue to go slow. We talk about this. To go fast, you have to go slow first, and you don't need to be in a rush in here. Now, the mechanics are very important. The first thing is you're going to line up, and you're going to sink in just like that. Going to back out, and your depth is going to be just a very slight elbow drop to the floor. That's all you need. And then your tension is going to be a little bit of a lean. That's loaded up. You're going to start to move the arm. About 25%. You're going to feel that, and then when it starts to pull, you're going to shift your body and go just like that. It should not be painful. It should not be excruciating. If it is, you did not watch the advanced palpation video. This is very important for an effective shoulder treatment and resolution of the shoulder problem, but you got to get your body mechanics right. So you're going to practice kind of going in here with that, stepping and going just like that. And that's where it comes from, the setup and getting the setup correct. Because if your setup isn't correct, you're not going to get an effective treatment.